Hi, my name's Graeme. So I'm a pharmacist working in primary care. As a bit of background to my career to this point, I graduated from the University of Bath in 2006 with a master's degree in pharmacy. I then worked in community pharmacy for 8 years. I then took an opportunity to work in hospital pharmacy to kind of get a different view and gain some different experiences in the healthcare sector. About 2 or 3 years ago, an opportunity arose for me to work within primary care, which I was very interested in. As pharmacists, we've got quite a wide, varying skill set, and it was an opportunity to see another sector and see how within pharmacy and the healthcare sector we can utilise those skills effectively. So when the opportunity arose through my employer to potentially move on to the Advanced Clinical Practice course at university, it was something which greatly enthused me, because with my previous background across various sectors within the healthcare setting, I thought I was well placed to bring together those different experiences and skills to see how I could benefit patients and upskill myself. At the time, there'd been a change to the Network Directed Enhanced Contract, which meant that pharmacists were able to have a deeper role within primary care, working alongside nurses, paramedics, physios, doctors as well, within primary care for the benefit of patients. Now, it was something that I felt I was well suited to, in that I had prior experience across both community, hospital and a bit of primary care experience as well. And always being somebody who has wanted to almost push the boundaries of what's available, and knowing that sometimes our skills as pharmacists are underutilised, I felt it might be something else that I could show what we could offer, so that we could try and basically use that for the benefit of patients. So in terms of the content of the course, it's heavily based around the 4 pillars of advanced practice. I found that as a pharmacist, I was better in some areas than others, but that is different depending on who is attending the course and what your background is. The people drawn onto the course come from varying backgrounds, as I've mentioned previously, things like nurses, paramedics, physiotherapists, and pharmacists such as myself, but it can be from other backgrounds as well. The clinical skills that they teach you will give you great knowledge and confidence in terms of being able to diagnose various different conditions. There's also elements of management and leadership, education, and also going back to things that you've done previously, maybe on other courses or previous education, such as things like research and how advancing things and giving you skills in terms of research profiles that can help to bolster evidence bases and help patients to understand their conditions more. So the course was structured in such a way that I was given 2 university study days per week to enable me to fit that around both my home life and my working life as well. Now, I have, at the time, had 2 younger children who are now obviously a little bit older. That was something which at first was a concern to me as to how that was maybe going to fit around my work, but both the course and my employers were very supportive and gave me the time and space and ability to learn to my best and perform to my best. There was no additional pressures. It was able to fit around work very, very well, and the pressures that I have at home. And I would encourage anybody that is thinking of whether this is right for them, definitely to consider that the Advanced Clinical Practice course is definitely something that can fit around most different lifestyles and regimes that people may have in their own personal lives. So the Advanced Clinical Practice course for me has been the single best career decision, and going on that course has been the best decision that I've made. It's enabled me to improve both my interpersonal skills, my clinical skills, things to do with education, management and research. Now, anybody who thinks that perhaps it's not for them or they've got concerns or doubts, I would definitely say that the course itself and the way it's structured is definitely beneficial. It enables you to improve skills in wide varying areas. Also, the support that you will gain from other colleagues and also from peers on the course is invaluable. You're all in the same position, and then you're all there as older learners. Some people may have not been in formal education before. Some people, like myself, may have been out of that kind of formal education in a university environment for a number of years. It was 15 years or so, approaching 20 years since I'd last been on a university course. However, I did thoroughly enjoy it. It's absolutely brilliant. I would encourage anybody to give it some serious consideration, not just from a personal perspective, but also from the fact that professionally you can increase your knowledge and skills and benefit patients in a way that you were never able to before. Perhaps previously you may have had to refer to other colleagues, whereas now you will have the skills and the ability to work at that advanced level where you can keep everything under one roof and deal with that patient holistically in one consultation.